Mr. Liu Dongru, Deputy Director of Hubei Health Commission. Mr. Liu Jiafa, the Secretary of Party Committee of Hubei CDC, and Dr. Li Yang from Hubei CDC. Mr. Tong Yeqing from Hubei CDC's Infection Disease Prevention Control Research Institute. We'll first give the floor to Mr. Li to brief you on the latest numbers. As of March the 26th, the total number of confirmed cases in Hubei province amounts to 67801, among which 50,006 are found in Wuhan, and accounts for 70% of the provincial total. In the last 24 hours, we have reported 0 new cases and 0 imported cases. It's the 3rd consecutive day for us to report 0 new cases. Cities outside Wuhan report 0 cases for the 22nd consecutive day. As of March the 26th, the number of patients still in hospital adds up to 2,896, among which 754 are severe cases and 245 are critical cases. As of yesterday, the total number of deaths adds up to 3,174. Yesterday, we report 5 new deaths, among which 4 are in Wuhan and 1 in Jinmen. The total number of discharged patients amounts to 61,731. Yesterday, we report 530 new discharged patients, among which 523 are found in Wuhan, accounting for 99% of the provincial total. Now let's give the floor to Mr. Liu to brief you on the prevention control of COVID-19. Dear friends from the press, good afternoon. Please allow me to brief you on some of the progress we've made in terms of the containment of COVID-19. With efforts from all parts, we have made periodical and temporary achievement in terms of the containment of COVID-19, and we've seen many positive signals. In Wuhan, we have basically cut off the transmission channels for the virus. Besides 1 case reported on the 23rd, no new cases have been reported for several days, and we have been reduced from high-level region to low-risk level region. Xinzhou, Huangpi, Jiangxia, Caidian, Dongxihu, and these 5 regions are evaluated as low-risk regions, and the other 8 regions are evaluated as mid-risk regions. And for the 22nd consecutive day, the other cities report 0 new cases: Huanggang, Xianing, Enshi, Shiyan, Suizhou, Tianmen, Shenongjia, and these 7 cities their patients have all been discharged. But we have to understand that 0 new cases doesn't mean 0 risks. Despite the reducing of the numbers, we are facing actually more tasks and challenges in terms of the containment, and we are facing much more difficulties in many fronts, as well as more heavy responsibilities on our shoulders. According to General Secretary Xi Jinping, it's important for us to win this battle in the end, and prevention should be prioritized. the NHC recently have been working with Provincial Commanding Center to carry out a week-long training in terms of the prevention control, during which this 1 plus 2 plus 3 plus N model was applied. The central government and provincial expert carry out this training in our province in order to educate the public and the health professionals on knowledges concerning public places sanitation, as well as the community-level prevention control. And these are practice-based trainings. We also invite the medical teams from other provinces to be part of this training. We also ask that the time of the training be arranged in a scientific way, so as to make sure that the knowledge that is learned through the training can be applied to practice. And we learn through practice, and it's important for us to address and improve our capacity to address the realistic matters in practice. This training is a clear embodiment that the NHC and the central government attach great importance to the prevention control of COVID-19 in our province. We will take this opportunity to improve our capacity of prevention control of COVID-19. Currently, Hubei province and the city of Wuhan are still facing daunting tasks in terms of the containment. With the resumption of work and life and we have already stopped the lockdown, open up the cities and the transportational channel of the province and the city. We will be seeing more mobility, more personnel mobility, and that might constitute risk to some scatter cases and risks of a local outbreak. Especially if we look at the global situation, the pandemic is spreading still in a drastic and fast manner. Therefore, we have to prevent import cases from being spreaded, and we have to guard against such risks. The risk that is brought about by imported cases. Internally, we also need to attach importance to prevention as well as treatment. For the fever clinic, we need to form this monitoring network to do pre-diagnosis and apply SOPs at the fever clinics and improve the sensitivity of diagnosis. We need to keep all the fever patients for observation so that no COVID-19 cases are left unattended. We also need to keep the information disclosure transparent. No misreport is allowed at this time. We also need to attach importance to community-level prevention and control, screen the 4 categories of people, and strengthen the accountability of the workplaces and handle the suspected situation in a timely manner. And 3, we have to establish this professional epidemiology report network. This is crucial for us to trace the origins of each case, so that we need to identify all the close contact or people that is closely related to the confirmed cases. Once a scatter case is discovered, we have to treat and admit this patient in a timely fashion. For the close contacts, we also need to carry very strict quarantine and test measures. In terms of the prevention of imported cases, the work are as follows. First, for all people who come into Wuhan, you need to file your health conditions. Second, for the 4 categories of patients, of people, they need to be receive the arrangement according to local policies. 3, for all people who entered into the province, they must be kept for a 2-week quarantine according to local government. And it has to be integrated in the local prevention control network, monitoring network. So we are still facing daunting tasks in terms of the prevention of internal transmission as well as imported transmission. We have established an information network online as well as an information ratification network. And we need to continue to carry out categorized treatment and strengthen community-level prevention control so as to form an enclosed circuit in our work. After this epidemic, we will be starting a health campaign in our province. During this campaign, we will be linking and making close connections with the prevention control as well as the improvement of people's physique. And also we will combine this campaign with the resumption of work and life. We also will be improving the environment and sanitation of public places, as well as strengthen the disinfection in public places, and educate the public of knowledges including the prevention control of viruses and bacteria, and the healthy manners in public vehicles, and so on. So this is a comprehensive and multi-level campaign to improve people's health awareness. This is a solid foundation for us to finally win this battle. In April, we will be welcoming the month of health campaigns. And we are calling out to people in our province to be part of this campaign and activity and make your contributions to it. And we shouldn't be relaxing at this moment, and we have to fight till the end. And will not back up till this people's war is finally won. We need to embrace the happy life with strong physique and make our province a healthy province. Now the floor is open to question. With Economic Daily, The public do not have a deep understanding of the function of CDC. So can you brief us on the work that you've done? Okay, Mr. Liu. Disease control is sometimes invisible because it's the service objective are people, not individuals. And our work, including the monitoring of important health indicators such as longevity and infectious disease index. Our responsibility also includes the diagnosis and food and drug safety evaluation and the publication of health knowledge. The disease control system is a soldier that is guard against possible risk in the health aspect. First, we did the epidemiology study as well as the trace of close contact. After a case is reported, the CDC needs to come to the scene and work with the relevant hospitals to carry out epidemiology study. And currently, our work required a 24-hour processing time. We're asking and striving to give the information in a timely and effective manner. Beside tracing and screening, we're also working with other provinces to form this information network in order to know more about the trace of the close contact. Second is the analysis of the epidemic. We have a 24-hour report network in terms of infectious diseases, and we have more than 250 report location to gather the statistics. We also conduct our investigation through big data technologies as well as data analysis, so as to have a better knowledge of the risk as well as the development trend of infectious diseases, which is used as important reference for the making of relevant policies. Besides, we also have developed this transferring of patients system in our network. 3, lab environment studies and such as the monitoring of disinfectants and the test of nucleic acid. Many cases were processed in our center. We also have conducted the gene sequencing of the COVID-19 virus so as to monitor its mutation situation. In terms of scientific research, our center also provides assistance in terms of the research of vaccine. We will see to it that the working vaccine be put into the market as soon as possible. We are also monitoring the risk of further rebound of epidemic. 4, the public health monitoring and evaluation. We participate in the construction of Huoshenshan, Leishenshan, as well as temporary hospitals. And we help with the design of the layout of the hospital so as to make sure that it is up to the standard of an infections hospital. We also give reference to the construction and renovation of negative pressure wards as well as infectious diseases zones. We also provide technical support in quarantine spot. We are working with multiple hospitals to monitor the situation of the disinfection cabinets. We're working with the Chinese Medicine Hospital of Wuhan and other medical institutions to monitor the situation of their HVAC system before the restoration of their daily life. We help the hospitals to do disinfection, and total number of areas amounts to more than 330,000 square meters. We're also helping them with the disinfection process, especially the 10 temporary hospitals and their handling of the sewage system in these temporary hospitals. For the designated hospital, we help them to do disinfection and have issued reports. 5 is to guide grassroots level prevention and control. We have established the emergency plan for patients' files monitoring, and we have assigned more than 40 experts to come to the grass level to provide technical support. 26 professionals were assigned to directly participate in prevention control in the city of Wuhan in other cities. We have carried out 5 trainings, and the number of trainees amount to more than 30,000. The publicizing of health knowledge is also a major responsibility of us. Through our official account and media from home and abroad, we are improving the public's awareness, and we have produced more than 60 educational videos, and the total number of clicks have exceeded 170 million times. With China Daily, the COVID-19 outbreak have given the public a chance to understand the basic knowledge of epidemiology. So can you tell us more about your study in this regard? The epidemiology is a study to understand the trace and some of the development trend. After we have received a notice, the team members will rush to the scene, and in 24 hours, we have to finish this study. After arrival, we need to put on PPEs and begin to ask the questions to the patients on their symptoms, their time of first appearance, and their history of exposure, history of contact, as well as medical records. After these information are gathered, the team members will work as scouts to put the different pieces together in order to find a common trace and underneath, and trying to discover the origins and transmission paths of the virus in order to cut the transmission paths and stop it from further spreading. We also need to know all of the information of all of the close contacts 2 days prior to the first appearance of the syndromes in order to cut the transmission channel. And finally, we will be forming and writing a report for epidemiology. So first of all, a study of this kind can tell us more about the origin and path of transmission of the virus, so that it will help us to cut the transmission path and stop the disease from further spreading. And second, we can know more information about the close contact so as to keep the potential source of infection into quarantine and reduce the transmission risk. 3. Through epidemiology study, we can understand more about the characteristic and development trend of the virus, which will be an important reference to the making of containment policies. Fourth, the timely transmission of epidemiology studies results to policies is essential in terms of curbing the transmission of infectious diseases. So prevention is at the center of containment. We rely on the hospital workers to reduce the stock amount of patients, and we rely on the epidemiology experts to reduce the incremental amount. So I call on to the whole society to cooperate with our work. This is not only means that you're responsible for yourself, but also for the society and other people. So can you tell us more about asymptomatic patients? How are they discovered? And once they're discovered, how do we deal with these very special kinds of patient? Asymptomatic patient refers to patients with no fever, coughing, or sour throat, or other syndromes, but shown positive results in terms of a nucleic acid test. So how do we discover the asymptomatic patients? It is mainly through the screening of close contact and the study of collective outbreak, as well as other epidemiology measures. They are potential source of infection, and they constitute certain risk. But according to the WHO, according to available statistics, the COVID-19 is mainly transmitted through patients with syndrome, and the asymptomatic patients are not the main source of infection. But we have to carry out the very strict management measures, and they have to be kept in quarantine for 2 weeks. And if the nucleic acid test shows 2 negatives after quarantine time, they will be qualified to be discharged. And if symptoms were shown during this process, they will be admitted to the hospital. So you don't have to worry too much about these groups of patients. You need to avoid collective activities and keep a scientific social distance. Wear masks. Do not rub your eyes with your hands, and carry out frequent ventilation at home is essential. You also need to monitor closely you and your family members' health conditions. Once symptoms were shown, we suggest that you go to the hospital to seek doctor's advice as soon as possible. What kind of qualities do epidemiology experts have? Does an epidemiology expert have? So can you tell us one of the cases that impress you the most? Our experts a team of experts have played an important role in terms of epidemiology investigation. First of all, you have to have medical background and have a very specific, very scientific attitude. Second, you have to treat the patient as friends and let them be honest with you and be frank with you. Three, you have to have strong sense and strong capability of analysis. You need to find the underneath linkages as well as the connections between seemingly unrelated evidences. Fourth, you have to have a strong will and regard yourself as a soldier. Here's one special case. This is a family case. We did an investigation on a young person. We asked about the exposure history. This person is fearful that he might lose his work and his family might be infected. So this patient is reluctant to tell us the information. But after careful inquiry, we found that the family member of this patient also have shown symptoms of fever symptoms. And through investigation, we found that this is actually a family cluster case. All the family members have been quarantined after this. Not only we discovered a first case and the transmission path, but also we have successfully stopped further spreading of the disease. So it is important for us to do our work well in order to further curb the transmission of the virus. Currently, we are gradually resuming work and life, so there is a rebound risk due to the increase of mobility in the society. So how do we prevent the rebound of the disease? With the recovery and the bettering of the situation, we have stopped the lockdown of the city. We have lifted the city lockdown, and many traffic control measures have also been lifted. Therefore, we have to take more active and more targeted measures to guard against rebound risks. First, we need to strengthen this report system at the community, in workplaces, and at individual levels. Health information has to be reported in a timely manner. Once a infectious disease patient or a suspected case is discovered, information has to be filed to local CDCs or medical institutions in a timely fashion. We also need to strengthen the implementation of policies for the delay misreport of the situation. The people accountable will be handled in the strict possible punishment. At the street level and the community level, we'll continue with this grid management system. For people who have newly entered this jurisdiction, we also need to carry out careful screening and registration. Public security and public health organizations and institutions have to report the outsiders' situation to the administration at the higher level. The community cadres should rely on the power of the people to to guard the defense line as a community. 3. Strengthen these emergency response system. Medical institutions of all levels have to practice this pre-diagnostic mechanism and strengthen administration of fever clinics, make registration of fever patients, and give timely diagnosis, quarantine, and treatment. For transportation authorities and managers of public places, you have to monitor the situation in a timely manner. Once fever patient is discovered, information has to be reported to the relevant departments so as to guard against the scattered cases and outbreak from happening. This is an important measure to prevent the further transmission of a local outbreak. 5. In order to continue to act according to General Secretary Xi Jinping's remarks and guide the businesses and enterprises to resume their normal production, we have issued notices on the administration for key groups and key areas. This is a guiding manual, and we'll also be strengthening trainings and send experts to the grassroots level to supervise the prevention and control. Despite the positive signals we are seeing, we are still facing daunting tasks in terms of imported risks and rebound at the local level, and will continue to strengthen our efforts in multiple fronts and continue our efforts. Thank you all. That's all for today's press conference.